This slide summarizes the cervical spinal nerve roots from C1 to T1, highlighting their motor innervation, principal muscles applied, major functions, reflexes, dermatomes, and important clinical correlations. On the left, notice the cervical spinal cord emerging through the foramen magnum. So the cervical enlargement from C5 to T1 gives rise to the nerve roots that form the brachial plexus supplying the upper limb. So first is C1 nerve root. So the C1 nerve root supplies the rectus capitis anterior, rectus capitis lateralis, longus capitis and longus colli muscles through the suboccipital and cervical plexus. So what does the C1 nerve root supply? Rectus capitis anterior, rectus capitis lateralis, longus capitis and longus colli muscle through the suboccipital and cervical plexus. So fibers traveling with the hypoglossal nerve also supply the geniohyoid and thyroid muscles. So fibers of the C1 nerve root traveling with the hypoglossal nerve also supply the geniohyoid and thyroid muscle. So what are its principal functions? They are head flexion, stabilization of the atlanto-occipital joint and swallowing. The principal functions are head flexion, stabilization of the atlanto-occipital joint and swallowing. There is no clinically useful deep tendon reflex. The dermatome includes the back of the head and occipital region. So what is the dermatome? Back of the head and occipital region. So next I'll go to C4 nerve root. The C4 nerve root is the major contributor to the phrenic nerve supplying the diaphragm. C4 nerve root is major contributor to the phrenic nerve which supplies the diaphragm. So it also innervates the levator scapulae and scalenus. So this C4 also innervates the levator scapulae and scalenus. So its primary functions include diaphragmatic inspiration, shoulder elevation and neck movements. So what are the primary functions? Diaphragmatic inspiration, shoulder elevation and neck movements, and there is no routine reflex. The C4 dermatome includes the lower neck and clavicular region. So what is the C4 dermatome? Lower neck and clavicular region. C5 nerve root. The C5 nerve root supplies the deltoid, biceps brachii, supraspinatus, infraspinatus and teres minor. So what are the muscles supplied by C5? Deltoid, biceps brachii, supraspinatus, infraspinatus and teres minor. So its principal actions are shoulder abduction, elbow flexion and lateral rotation of the arm. What are its principal functions? Shoulder abduction, elbow flexion and lateral rotation of the arm. So the associated reflex is the biceps jerk. So the C5 dermatome covers the lateral upper arm. Clinically, a C5 lesion results in weak shoulder abduction and elbow flexion. So if there is a lesion in the C5, so this will result in shoulder abduction will be weak and elbow flexion will be weak. C6 nerve root. The C6 nerve root supplies, what are the muscles supplied by the C6 nerve root? So it supplies a brachioradialis, wrist extensors and pronator teres. C6 nerve root supplies the brachioradialis, wrist extensors and pronator teres. What are its major functions? Elbow flexion, wrist extension and forearm supination. Major functions are elbow flexion, wrist extension and forearm supination. Elbow flexion, wrist extension and forearm supination. What is the corresponding reflex? It is the brachioradialis jerk. So the C6 dermatome includes the lateral forearm and the thumb. C6 means lateral forearm and the thumb. Lateral forearm and thumb. C7 nerve root supplies the triceps brachii, wrist flexors. C7 triceps and wrist flexors and finger extensors. wrist flexors, finger extensors. So its principal actions are elbow extension, wrist flexion and finger extension. Elbow extension, finger extension, but wrist flexion. The corresponding reflex is the triceps jerk. C7 dermatome is centered on the middle finger. C7 means middle finger. C8. The C8 nerve root supplies the finger flexors and interossei muscles. C8 finger flexors and interossei muscles. Its major functions include finger flexion and fine finger movements, and there is no reliable deep tendon reflex. So the dermatome includes the ring finger, little finger and medial hand. So what does the C8 supply? The ring finger, little finger and medial hand. T1 nerve root. The T1 nerve root supplies the interossei muscles, adductor pollicis and intrinsic hand muscles. So the T1 supplies the interossei muscles, adductor pollicis and intrinsic hand muscles. So its principal functions are finger abduction, finger adduction, pinch grip and intrinsic hand movements. The T1 dermatome covers the medial forearm and arm. So what are the principal functions of the T1 nerve root? Finger abduction, finger adduction, pinch grip and intrinsic hand movements. The T1 dermatome covers the medial forearm and arm. Deep neck muscles. The deep cervical muscles include the suboccipital muscles supplied mainly by C1 and C2 and the prevertebral muscles supplied by C1 to C3. So the deep cervical muscles, they are supplied by the suboccipital muscles. They are supplied by C1 and C2 and prevertebral muscles supplied by C1 to C3. Phrenic nerve, it arises from C3, C4 and C5 with C4 providing the major contribution. Remember, C3, C4 and C5 keep the diaphragm alive. The phrenic nerve arises from C3, C4 and C5 with C4 providing the major contribution. Remember, C3, C4 and C5 keep the diaphragm alive. Then I will go to C2 nerve root. So the C2 nerve root, it supplies the suboccipital muscles, longus capitis, sternocleidomastoid and trapezius through proprioceptive fibers. C2 supplies the suboccipital muscles, longus capitis, sternocleidomastoid and trapezius through proprioceptive fibers. Primary actions are head extension and rotation to the opposite side. What is the primary action? Head extension and rotation to the opposite side. No deep tendon reflex, and C2 dermatome supplies a posterior scalp behind the ear. So the posterior scalp behind the ear is supplied by C2. C3 nerve root contributes to sternocleidomastoid, levator scapulae and anterior and middle scalene muscles, and it also contributes to the phrenic nerve. So it's the sternocleidomastoid motor via cranial nerve 11 and proprioception via C2 and C3. So it also contributes, the C3 contributes to phrenic nerve. Its major functions include neck flexion, lateral flexion, shoulder elevation and inspiration, and there is no routine deep tendon reflex. The C3 dermatome corresponds to the side of the neck. The side of the neck is by C3 dermatome. So brachial plexus, it is formed by anterior rami of C5 to T1, forming the upper, middle and lower trunks. Brachial plexus by anterior rami of C5 to T1. So key clinical correlation. So C5 palsy cause weak shoulder abduction and elbow flexion. C6 radiculopathy cause pain and weakness over the lateral forearm and thumb. C6 means pain and weakness over the lateral forearm and thumb. C7 weak triceps function with numbness of the middle finger. C8 weak finger flexion with paresthesia of the ring and little finger. Ring and little finger, C8. T1 weak intrinsic hand muscles with sensory loss over the medial forearm. T1 means there will be a weakness of the intrinsic hand muscles with sensory loss over the medial forearm. C8 means weak finger flexion. C7 means weak triceps function. C5 means shoulder abduction and elbow flexion. C6 means pain and weakness over the lateral forearm and thumb. So the key take-home messages include C1 and C4 primarily supply the neck muscles and diaphragm. C5 to T1 form the brachial plexus and innervate the upper limb. So each cervical root has a characteristic muscle action, dermatome and reflex. This is useful for localizing the neurological lesion. So any cervical root, muscle, dermatome and reflex. So understanding motor deficits, sensory changes and reflex abnormalities is essential for diagnosing cervical radiculopathy.